And now I'd like to talk about a case study involving a patient by the name of Gary. Gary underwent a laparoscopic radical prostatectomy in the public sector 1 year previously. Gary made a fairly uneventful recovery following his operation, and his main concern now is that he hasn't had any erections. So he decided to come and see me. So when I met Gary, I explored with him what he had found and heard and read about erectile dysfunction, and it seems he knew very little. That he decided not to do too much reading because he was worried that he might find something that told him that there was no hope and he should give up now. So he was really hoping that I had some strategies to help solve this little secret that he hadn't shared with anyone. So when I discussed Gary's sex life with him, he described being with a woman who was 20 years younger than him by the name of Tina. And Gary and Tina had a very healthy sex life prior to Gary's surgery. They had intercourse 3 to 4 times per week, and Gary described their sex life as very passionate and adventurous. The main concern Gary had was that his partner Tina defined her desirability on how hard his penis became, and that she felt wanted and desired when he was able to have penetrative sex with her. So, since this is no longer happening in their relationship, he has noticed a marked shift in their connectivity and even their intimacy. So, I asked Gary further, what did he think Tina's understanding was about his prostatectomy operation? And he had been told along the way that his function would possibly recover because he had a non-nerve sparing operation. And so they'd kind of been hanging on, waiting for things to recover, and they hadn't. And this had driven a wedge between Gary and Tina. So the challenges here were evident that Gary hadn't been able to move beyond the penetrative sex into other means of being intimate with Tina, and that he felt isolated and disconnected because he was no longer able to give her what she wanted. And as a last ditch attempt at salvaging what they had, he was here in the clinic to get some strategies. So I spoke to him about our algorithm for erectile dysfunction following prostate cancer, that we would start um, penile rehab 4 weeks after the operations to help improve the blood flow. So this came as a bit of a shock to Gary when he's now a year down the track. He was quite anxious about what that meant for him, and was there any hope for recouping any of his function? And I said, well, it's largely going to be a wait and see. And so Gary decided that he would try the vacuum erection device. Now, because Gary was a public patient and wasn't under any of the urologists at the clinic, he only wanted to come for one session. So I was faced with quite a challenge to try and understand his case and provide advice for him in such a short period of time. And I was flying a bit blind because I didn't have a surgeon to talk to about his operation or anything related to that. Furthermore, just hearing from Gary's perspective about the issues was making the issue more complex, because I was unable to hear from Tina as to how she felt about the situation, and whether there was any other underlying issues in the relationship that was driving this wedge between them. However, Gary was quite determined that his sexual health issues would be solved if only he could achieve and maintain an erection. So the treatment plan was for him to purchase a vacuum erection device and see if he was able to achieve and maintain an erection long enough and hard enough to enable intercourse. Now, I never actually saw Gary again, but I did receive an email from him asking if he could purchase some more rings to use with the penis pump. So he also mentioned in the email that he was really thrilled with the vacuum erection device, that this worked a treat for him, and that he was able to have penetrative sex with Tina again. So in reflection of this case study, several things come to light, and the one being that perhaps it would be prudent to offer a package whereby patients pay an upfront fee and have several sessions, one to certainly follow up from any interventions placed, and secondly that now that I am looking at patients through the biopsychosocial lens, I will be able to better understand and assess patients for relationship issues, whether it be with themselves or with their partner, to better understand how that impacts on their sexual health and well-being.